This is Dr. Shaun Jay at Function First Chiropractic, and today I'm going to talk to you a little bit about diaphragm breathing. Now, a lot of people don't realize the importance of diaphragm breathing. You'll hear it sometimes if you're in yoga communities or even if you're with a singing coach or something, because they always tell you to sing through diaphragm. But people don't realize the importance of it even just in spinal care, and people that have neck pain, people that have low back pain, because the diaphragm is actually the key core stabilizer in the low back. So if the diaphragm isn't engaging, you're not getting that stability in the low back, and also you're going to overdevelop those accessory breathing muscles, the scalenes, the sternocleidomastoid, and those muscles, if they're overdeveloped, are going to pull your head forward. So a good way to kind of test yourself to see if you are breathing with your diaphragm or not is just to look at yourself whenever you are trying to take a couple breaths in. So if you're breathing in and you're noticing your shoulders are moving up and down, then that's not really a good sign. What you really want to look for is basically that stomach coming in and out. That basically means that the diaphragm is engaging, that you're getting that air by that diaphragm contracting and bringing air into the lungs. But if you're not doing it, then it's something you'll have to work at to practice and to retrain yourself, because with any people that have neck pain or low back pain, if they're not getting that diaphragm activation, they're not getting that breathing in there, you can adjust them, you can do muscle rehab, muscle strengthening, and you'll notice a plateau that you just can't get past, because as much as you strengthen those muscles in the neck, if your accessory muscles, the ones that are in conflict with those muscles, are pulling your head forward, you're not going to get relief, because your diaphragm has to be working in order for you to give these guys a break and to gain that motion back to keep the head over the shoulders. So the first way to start out with diaphragm breathing, especially if it's been years since you've been a diaphragm breather, typically with people, if they're not diaphragm breathers, they probably lost that during their adolescence. They lost that whenever they started becoming a teenager, and they started, the girls will basically, they'll kind of slouch forward like that, or they'll suck in their guts, guys trying to impress the girls, they'll suck in their guts, and the girls will kind of roll their shoulders down and try and look a little shorter than they really are. They're getting a little self-conscious with puberty. So when they do that, then that kind of paralyzes the diaphragm in a sense. Because when you're in that position with the shoulders rolled and the head forward, it's virtually impossible to get the diaphragm to engage. When you're doing that, you're going to get your breathing from those accessory muscles, the sternocleidomastoid, the scalenes, and those are all going to work. It's a vicious circle. They're just going to self-propel the problem and make it keep strengthening it if you keep using it, and then just keep pulling the head further forward. So, like I said, laying down is the way you want to start out. And what you want to look for is that stomach engagement. And a lot of times you'll have to exaggerate the response when you first start out because you're just not used to it. So you really want to palms face up. You want to externally rotate those shoulders. Just opens up the chest a little bit. And what I'll tell my patients is basically whenever you breathe in, I want that stomach to come up. So whether you have to exaggerate it and just forcefully look like you have a big beer belly when you're breathing in, that's how you got to start out to engage it. So we just breath in, and if I'm having a lot of trouble with them, whenever they're breathing out, it's very important to expel all the air out of the lungs. As they breathe all the air out, I'm pushing down against the diaphragm. Breathe in, and they're exaggerating. And as you continue to practice that, it'll become a lot easier and a lot easier. And when you can do it pretty easily laying down, then you can move to standing or a seated position. And again, we want to practice this with the arms, palms face up, shoulders externally rotated. And you just have to be really intentional when you first start out, because you're retraining habits that you've lost over sometimes decades. and it's very tough to get that back. But once you get it back, your body wants that. I mean, it's the more efficient way to breathe, and you'll notice a reduction in your symptoms. As the more that you're engaging the diaphragm, the more that you're giving a break to those scalenes, the sternocleidomastoid, those accessory muscles, the less that you're using them, the easier it's going to be to hold your head up straight, keep that good posture up. So it is very important to do. It oftentimes takes months to fully re-engage the diaphragm and to become a natural process again, but it is very much worth it, and it's something that's going to help you to just maintain better spinal care for the rest of your life.